Hello, I'm Chris Jones from QNX, and I'm joined by Mr. Amer Raza, a consultant at the Cromwell Hospital. If I'd just ask you to give an overview of your background with robotics.
Thank you for inviting me today, and great to be here with you. I started my robotics in 2021 on DaVinci Xi system, a multi-port robotic system. We started this process in 2021 with the simple procedures now, and over the last 4 years now, we are doing over 350 gynecological procedures here in single port and multi-port robotic system.
That's great. And in your time working with robotic surgery technologies, what's the biggest advantages that you've seen that is delivering outcomes for patients?
Robotic surgery absolutely has been a sea change in my own clinical life. I was trained as a laparoscopic surgeon, so you are learning how to do keyhole surgery and to have a minimal trauma, early recovery, lesser pain. So with all those things we learned over time, robotics then came along, and robotics have changed the way we operate. We've seen now in robotics now patients are going home early. There's a less post-operative pain, there's a less risk of infection, and the reason for that is that surgically, robotically, we are cutting the tissue inside so precisely with a minimal tissue trauma, with a less bleeding inside, that it leads to all those benefits in the patient outcome. So I've seen a massive change doing robotic surgery as compared to our previous surgery.
Since you've been working with surgical robotic systems, what are the biggest improvements and benefits you found for patients?
The robotic system has been absolutely a sea change for us as a clinician. I was trained as a minimal access surgeon, so it means we are quite grounded into principles of minimal trauma, early recovery. When the robotics came in, it just gave us another tool by which we can operate more precisely with a less tissue trauma inside, with a less bleeding inside. And all these technical things led to lesser pain after the operation, quicker recovery, earlier discharge, and we can see a huge benefit to the patient as well. And not only this, we were able to manage much complex pathology now with the keyhole approach, robotic approach, as compared to before. For example, if it's a large fibroid uterus, I will prefer to do open myomectomy instead of a keyhole myomectomy. But robotics allows me to do keyhole robotic operation now to remove that large fibroid. So there's a lot of changes where we can do more complex operation now with the keyhole robotic approach as compared previously. So we have seen in these last few years now that massive change, improvement in the patient's care with the robotic approach.
That's great. And what key things would you want the makers of surgical robotic systems to focus on in the future? What improvements are there that you see that could be helpful for patients?
Robotics have been a massive change, and the one thing we have seen, robot is obviously a machine, but we can see now that it's making a big difference and number of things which are being done, and we are part of that change. For example, now I trained myself on a multi-port robotic system, and now we have moved on to single port robotic system. Instead of making 4 holes, we're doing everything from one single hole, which means even lesser pain and less risk of infection because I have 1 incision instead of having 4 incisions. But more to it actually. I think now next thing is going to be how artificial intelligence helps us further. For example, now we need to see how we can look at the outcomes more effectively. So how this software and robotic system can be integrated into our patient's care and post-operative care, that we get the data from the system to educate and help us as a clinician and help the hospital as an institution to improve the patient's care. And third thing is there's a massive training needs as well. I think this data coming from the robotics will allow surgeons to say what they need to practice, what they need to do to make their procedures better. So there's a huge feedback system built into robotic system. So I think that will be the big thing. I think we'll be looking at industry to help us with the teaching and training.
Okay, perfect. And with legislation like the EU Cyber Resilience Act coming into force, how much of a concern is cybersecurity for the administrators and managers of a hospital like the Cromwell?
It's a very huge concern. It's like as serious as infection concern. We are very careful when it comes to infection screening. Everything is checked. Same thing comes to cybersecurity as well. With the systems, DaVinci system and other systems linked to online systems, we have to be very careful and clear that all the systems are safe and resilient for anything, and huge effort needs to go in. So I'm fully support of this legislation which makes sure that their safety is paramount and nothing is breached in terms of confidentiality and patient safety.
We agree. And what trends are you most excited about for the future of surgery and robotic surgery?
Robotic surgery is changing with a speed light. It's very quickly now, we can see now that artificial intelligence, softwares and robotics together, they are making a big difference. I am very excited to see how it will evolve into teaching and training doctors when they're operating on the robotic system. I'm also very keen to see how instruments are becoming even more miniaturized to do microsurgery with these things as well. Microsurgery diagnostic is something else coming as well in the future, which will absolutely change the way we operate. So I will say there's a massive way ahead where we can see that things are changing in robotics now to improve the patient's care.
Thank you very much. Thank you.